Hi, I'm Chris Hyde. I'm a senior resident in the emergency medicine residency program at McMaster University in Hamilton, Ontario. I wanted to give you some background on my study that I've done. It's called Simulated Mass Casualty Events Can Increase Resident Confidence in Using Scarce Resource Mitigation Strategies. That's a bit of a mouthful, but background on this is that we know mass casualty events happen. They're rare, they're devastating, but emergency departments, emergency doctors need to be prepared for them. And so there's specialized skills that are required in those circumstances. There's overwhelming patient need. There's not enough resources to meet that need. And so providers need specific strategies to be able to deal with that scenario. So a couple examples of those. An example would be a conservation strategy where a patient that you normally give 2 units of packed red cells to, you just give 1 unit instead, trying to conserve more so that you can provide more people with blood. Another strategy would be a substitution strategy where instead of using a chest tube for a chest thoracostomy, then you would use an endotracheal tube because you've run out of formal chest tubes. And so those are both strategies that you might employ. Now, emergency medicine residents learn these. They learn them along the way. They have an understanding from lectures and from reading. The real problem, though, is these aren't technically difficult skills, but the decision to use them can be very difficult. And so what we wanted to do is provide a simulation environment where the residents could practice these skills. So we set up an emergency department. For realism, we made it a half-size department compared to our local level 1 trauma center. It had acute, intermediate, and ambulatory beds. It had critical care equipment. This was a multidisciplinary simulation involving over 90 people. There were staff physicians, residents, medical students, nurses, RTs, paramedics, all involved. In the simulation, the resident physicians were the treating clinicians. And so their role was really to deal with the overwhelming surge of patients that were coming into this trauma center and provide the best clinical care they could, knowing that they didn't have enough resources to deal with it. And so the goal is for them to start employing some of these scarce resource mitigation strategies while caring for these patients. Now, the goal was to provide an environment with emotional realism. It was chaotic, it was loud, it was difficult to work in, but those are the conditions that you'd be facing in a real mass casualty scenario. And so with the emotional realism and the difficulty in choosing to implement these strategies, we wanted to provide an environment that also provided psychological safety, so that through action or inaction, if a patient died, if harm was done, then that would be a learning experience rather than a devastating emotional experience for the participants. And we set it up with a pre-brief. We allowed them to act as realistically as possible, and then did a debrief at the end to make sure that there were no lingering questions from the simulation after. We did before and after surveys to understand the residents' experience better. We found that most residents, over 90%, used some strategy, that they chose a substitution, conservation, some sort of strategy. When they had confidence in that strategy, they were more likely to use it. It's not surprising. But what we really were happy to show is that by going through this experience, participating in the simulation, that the residents' confidence in using these different strategies increased before and after. And so with that association between confidence in using the strategy in the sim, we expect that in real life, after going through the simulation, if they're faced with this actual situation of a mass casualty event, they would be more confident in providing care and using these specialized strategies. Now, one lingering question is, how long does this confidence or how long does this effect last for? And we don't know the answer to that. And so future studies are going to be focused on how often should we do these sims, how long does the effect last for, and how can we optimize the resident learning experience for them. So please come by my booth, ICRE 2018. Find me, ask any more questions you have. I'd love to talk more about this simulation and our experience with it. Thanks a lot.